Right. Now I am going to tell you about the tracheal suctioning. Either it may be endotracheal tube suctioning or tracheostomy tube suctioning. Tracheal suctioning is very important to maintain the patent airway throughout. If there is any block, either the tracheal tube, the patient will go into hypoxia. So regular tracheal suctioning is very important to do the tracheal toileting to remove the secretions and maintain the patent airway. So how to do this tracheal suctioning? There are various steps involved in tracheal suctioning because the tracheal suctioning is very dramatic. It may cause a lot of problems to the patient. Before doing a tracheal suctioning, patients should be hemodynamically stable. And well sedated. If a conscious patient on ventilator, if you do the tracheal suctioning, you will have a lot of pain, a lot of hemodynamic changes, arrhythmias might occur. So patient should be well sedated and vitals should be stable. Right. Next, you have to check the equipment. That is required for tracheal suctioning. The suction apparatus. Suction apparatus, it should at least have 200 to 400 centimeters of water. It's the suction force. Right. We should have the suction catheters either 12 French or 14 French. I am speaking for adults. For adult patients, these are the suction catheter sizes. For pediatric patients, it's very specific. Case wise, you will be informed regarding the suction catheters what you have to use. So, how to do the tracheal suctioning? The procedure to do. First, you need to pre-oxygenate the patient. Pre-oxygenate the patient at least 3 minutes before you start suctioning, because for suctioning you need to disconnect the ventilator and patient might have hypoxia. By giving 100% oxygen for 3 minutes, you will have good amount of time to do suctioning and patient may not go into hypoxia. Use sterile gloves always, not the unsterile gloves which we use, the safe touch gloves. Use always the sterile gloves because it should be totally aseptic procedure. The bacteria which might enter the tracheal tube may cause what is called as ventilator associated pneumonia. And if a severe ventilator associated pneumonia, the patient may die. So it's your responsibility to do with utmost asepsis. First you disconnect the ventilator, then pass the suction catheter either 12 French or 14 French till you find the resistance. You pass the suction catheter with the vacuum closed. That you can do by pinching the catheter at the top end and pass the tube till you find the resistance. Next, release the vacuum. Pull the catheter slowly with swirling motions like this, with rotatory motions. Rotatory motions. Stay at a point where you get maximum secretions. Then pull out the catheter. Then connect the ventilator. This entire process, the procedure should be done within 15 seconds. Within 15 seconds. It should not take long time. So this suctioning you can do 3 to 4 times till all the secretions you have sucked out. Finally, you have to do couple of ambu breaths to expand the collapsed lung because of suctioning. After this, you can post-oxygenate for 3 minutes with 100% oxygen. Next, I am going to talk about weaning and extubation. Criteria for weaning. Once patient is ready to be extubated, you have to